Wonderful. All right. Hello, everyone. My name is Jeevan. I'm the co-president of Sci-Chi, and I'm currently working alongside the Sci-Chi external team, so I'll be your host for today's event. Before we continue, I would like to begin with a land acknowledgement. We may not be physically on campus, but UBC Sci-Chi operates on UBC's infrastructure, which is located on the traditional, ancestral, and unceded territory of the Musqueam people. Right? I do want to reiterate that this event will be, so once again, the event will be recorded, so feel free to keep your cameras off or on as you feel comfortable. So yeah, today's event is the UBC Sci-Chi Expert Talk, A Journey to Art Therapy. So Sci-Chi is one of the largest international honor societies in the world, with the purpose of providing academic and professional development opportunities to students. In service of this goal, we here at UBC chapter of Sci-Chi have developed the Expert Talk series, a bi-weekly event where we invite professionals in the field of psychology to share their experiences, advice, and knowledge with UBC students. So today's talk will feature Elspeth Robertson. Elspeth got her undergraduate degree at Queen's University in psychology and her master's of counseling at Adler University. She is a registered clinical counselor and a professional art therapist. She is also certified in eco-psychology. So Elspeth has her own practice where she uses holistic approach to therapy. So yeah, students, if any time during the talk you have any questions for our expert, please type them in the Zoom chat or speak up during the presentation, and we will address them during the Q&A section of the event. Now, with the formalities out of the way, I would like to introduce our speaker, Elspeth Robertson, and thank you so much for joining us today.
Hi, everyone. Thank you for having me. I'm going to go ahead and share my slides. Okay, we can see them? Yes? Okay, cool. Thank you so much for that introduction. I put my own little introduction slide too, because I'm just like, look how cute I am. And I just opened my own studio practice. It's called Intrinsic Therapy. And I always just love sharing pictures of my studio so you guys can kind of look at my studio for a minute while I, go into this introduction. I opened my practice in 2020. I work downtown in Vancouver. I did my undergrad at Queen's, as I said, so maybe we have some Ontario folks here, I don't know. And I moved to Vancouver to attend Adler University for the Counseling Psychology Art Therapy program. When I was in undergrad, I was really fortunate enough to attend an info session like this about art therapy, and that experience changed the trajectory of my studies, my career, my life. I don't know if I would be in this field unless I had that experience. So I'm so grateful for that experience. And I'm really excited to be here today and share just everything that I've learned with you so that you might also be able to experience this. So you can ask me any questions. When I entered the art therapy field, it still felt so new to me, especially coming from Ontario. It's a little bigger here in Vancouver, but I didn't really know a lot about it. So I'm excited to kind of share that with you. And let's get started with just an opening exercise. As a therapist, I love to offer just small moments of grounding, connection, and reflection, especially when we're entering a new space and situation. I always want to make sure that you feel calm and safe and comfortable, even when we're meeting in a virtual environment like this. So today we'll do an opening at the beginning, and then at the end of my presentation time, I'll do a little closing with you. And everything is just an invitation. So please only participate if it feels comfortable for you. So you're joining from home, maybe you're in your office. As this opening exercise, look around your space and find one thing in your space that is representative of how you are feeling at this moment. It can be anything, large or small. Just looking around, what's speaking to you, What stands out? This is a moment of mindfulness, so we're paying close attention to your space and your present moment feelings, allowing for that pause. So if you found an item, an object, either pick it up or maybe you want to just place your hands on it if it's too heavy to pick up. Feel that texture, the weight of the object. Do like a little observation. What elements does this object have that is representative of how you feel today? And then you might ask the object, hey object, what do you need? Like if my object is, this tells you a little bit about me, I guess, is I have just moss on my desk. Like, this is where I work, here's some moss. If that's my object today, I might wonder, does it need a soft place to rest, or does it want to be held? Or asking just, what does this moss need? And I love doing this exercise because it just offers this moment of slowing down. And when we offer what an object needs, we might also offer that to ourselves. So I want to invite you to offer yourself whatever you need during this presentation time. Maybe looking at a screen feels really hard right now. That's okay. You can choose to just listen. Maybe you're full of energy and you actually don't want to sit still for half an hour while you're listening. That's okay. Get up and move. Maybe you want to take notes, but you also want to lay out on the couch. That's okay. Turn on a transcription app. However you want to show up in this presentation is absolutely okay. I'm never going to call anyone out for not like staring at the screen. So people with their cameras off, keep your cameras off if that's how you want to show up. And off, and turn yours off too if you'd like to keep yours off. So leading into what is art therapy then, with this brief introduction, I actually use this opening exercise of finding that object and asking what it needs. This is one that I do with all of my new clients when they first come to visit me in my studio, because that safety, that comfortability in the room is the most important thing for me as a foundation for a therapeutic relationship. So we always want to take a little bit of time surveying our environment and seeing what we have in that environment. I wanted to share it with you today as a representation of how art therapy uses image, symbol, and metaphor to connect with our thoughts, feelings, and body sensations. In a typical art therapy session, if we did this opening exercise, we would spend more time with this object and we'd work with the object as a representation of self. So if my object is moss, I might ask, how am I like moss today? Or my moss is really dry. What does it need? Like maybe it needs to be in a moist environment. I might invite my clients to respond to this object with art. So maybe they're going to write a short poem or story about the object. Maybe they're sculpting a little friend for the object out of clay, or drawing an image that is representative of what the object needs. Exercises like this are quite typical in art therapy. A therapeutic process called externalization asks us to bring internal narratives outside of self, because it's often easier to respond to a question like, what does this moss need? Rather than, what do you need? So art therapy is really simply therapy. It is using the same curiosity and exploration that you would get out of a talk therapy session. And we're just using art, tools, and methods to come to this greater understanding of self. So the Canadian Art Therapy Association describes art therapy as using imagery, color, and shape as part of the creative therapeutic process. When using these, thoughts and feelings can be expressed that would otherwise be difficult to articulate. So essentially, we are using art as a language. And this is a common language that we all share, even for people who don't identify as artists. I have a lot of people coming in and saying, well, I don't know if I can do art therapy because I'm not an artist or I'm not good at art. And proficiency in art is not a prerequisite for coming in and doing art therapy, because we're not looking to make good art. We are looking to work with art as this tool for self-exploration. And we do all share this common knowledge because children across all cultures spontaneously create art. We all start with scribbles before we can even write, before we can use language as a communication aid, we are using art as a symbolic language to understand our world. So it's something that the majority of people can connect to. The majority of people can hold a crayon in their hand and say, I have held this material before, and I know what I can do with it. I know how it's going to show up on the page. So effectiveness of art therapy. This is something that when I was in undergrad, I didn't know a lot about. I just kind of knew that I wanted to come in and be an art therapist and work with art because I thought it would be so fun and so meaningful. And in my personal experience, I had seen how art could be life-changing, how I felt so much calmer when I did art. But my undergrad, and maybe you've had a similar experience, my undergrad was really focused on cognitive and behavioral approaches. A lot of when I was in my undergraduate classes, CBT was the only kind of treatment method that was ever shown to me. And so when I said that I wanted to study to be an art therapist, I got some skepticism. I know that I had a few professors who were like, that's not real. And I didn't know what to say to them. And so now I do. And the kind of question here is, with this current focus on cognitive and behavioral approaches in therapy, is there enough evidence to support using expressive approaches like art to guide the growth and change process? And what is really incredible is that not only is there evidence that art therapy works, but there's evidence that it may work better than talk therapy approaches in certain circumstances. Spoken language can be limiting, which means that talk can be limiting. Sometimes there just aren't words for what you're trying to explore. So here's an example from neuroscience. When we experience a trauma, higher order processes in the brain, like language processing, which is in our prefrontal cortex, can become unresponsive because we've experienced an event so significant that when we recall this event, or when we're in the same kind of frame of reference that this event happened, our bodies need to just stay safe. And so we whoosh away our cognition or language processing. So when somebody has experienced a trauma, sometimes going to talk therapy can actually feel so frustrating because there aren't the words to talk about something. And it's not that you don't want to talk about it, it's that we physically cannot. Our brains just don't have the capacity. And so introducing a medium like art can bridge that gap and integrate strong emotions to allow for a new form of communication that doesn't need to involve language. So maybe you've heard of EMDR or somatic therapy. Those are kind of like buzzy right now in the therapy world. These are also approaches that use these same underlying principles, acknowledging that experiences are not just held within our minds. So we can't always use our minds to move through these experiences. So this is not to say that talk therapy is not effective. This is just to say that there are different options and there are different approaches that might work for different people. And so there is so much effectiveness in art therapy if that feels like the right approach for you. Art therapists work with many populations. I often hear the misconception that art therapists only work with children or older adults, or people with neurodivergence, or people with unique sensory or language processing needs. So it's true that art therapy can be a really wonderful resource for these populations, especially based on, what I just said. Like if I have a language processing or a sensory processing need, yeah, doing art is going to be so beneficial for this. But art therapists really work with anyone and everyone. Any specialty or focus that exists within the broader therapeutic field, art therapists can also specialize or focus on. So sometimes when we see art therapists in the field, we might feel that like this is the box that they belong in. This is like art therapists only work in hospitals, or art therapists only work with children. And I really want to offer this broadening of perspective of art therapists work with anyone that any therapist can work with. So for example, I run my own practice. I get to choose who I work with. That's not always the case. If you're working in agencies or schools, you don't get to choose, but in my case, I do. And so I work with adults, typically younger adults, like 25 to 40, and I work with youth. And my focus is on working with people who have overfunctioning anxiety, perfectionistic and people-pleasing tendencies, and burnout. So it's a pretty narrow focus. But working with art therapy with this population has been so fulfilling to me. And I know that there are enough art therapists in our field that the other populations are also served. So if that is kind of hesitancy to exploring art therapy, that you feel like you would only have to work with one sort of population, I just want to share that it really can be open to so much. And I want to share how I work with art in session. So there's kind of 3 ways that art therapists work with art. The first way is distraction or grounding. Really connecting with art supplies makes the therapeutic process feel easier in general. So if I go to talk therapy, and I do go to talk therapy, and I'm sitting across from my therapist and I don't know what to say, and I'm just like staring at her, it can be sometimes just so awkward and uncomfortable. And sometimes that uncomfortability is okay, but sometimes it feels excruciating and it limits clients to come to therapy because that feeling is too big. And so art just fundamentally can be that coping tool of, I'm just going to squish some clay right now, or I'm going to look down at my page and I'm going to doodle because it's easier than just like staring at you. So this is kind of one of just like the fundamental ways that art can just make us feel a little less alone in those hard feelings. The other way that we work with art in therapy is art as therapy. So this is just acknowledging that the act of creating art is therapeutic in itself. If all I do in an art therapy session is give my client the space to paint, or the space to draw, or the space to scribble, if that's all I do, that can sometimes be enough. That there is this inherent therapeutic element towards putting what is in your head on a page, towards letting yourself have this time and this space and this presence with art. There are also just these amazing benefits within our brain. I love neuroscience, so I like to talk about the sensory aspect of creating art that can really facilitate positive coping skills and integration of strong emotions. When I talked about that prefrontal cortex earlier, so if we're not using the language processing part of our brain, but we're using the sensory aspect, we're connecting our sensory motor processes with our amygdala function and allowing some just simple nervous system regulation. And if you don't know what those words mean, that's okay. I get really into it. Feel free to ask me questions after about that stuff. Feel free to just like take what you want and leave the rest. If you don't care about the brain, that's also cool. So actions like gliding pastels across a page, squishing clay, painting, collaging, they can just really all help calm the mind and the body. And when we use art as therapy as well, we can process emotional experiences through art. So for example, if a client comes in and they're saying that they're frustrated, and I see that they're frustrated, I might give them a bunch of popsicle sticks to snap, or I might give them paper to rip up. We're gonna use our art materials in a way that helps our emotions process and come through. I might do, if somebody's sad, I might offer watercolor and painting that we can't really control, and I might offer just this fluidity and flow. There's a lot that we can do with materials to help in processing with art. And then the other way that we work with art is art in therapy. And so this is exploring therapeutic themes through art. This is what you would do with a talk therapist through talking, just all you're doing is adding art to it. So this is where externalization, symbolic and metaphorical language comes in. So for example, I said that I work with perfectionism. A really common art intervention that I do with clients is we create an image of our inner critic, that voice in your head that maybe tells you that you're not good enough, or that you should be doing something, or you're doing something wrong. And so we're going to create an image of like, what does that voice look like? We're going to meet them. We're going to take it outside of our mind and give them a name and characteristics, so that when a voice pops up that tells us that we're not good enough, or whatever it is that it says, we have a way to respond to it. We can say, oh, that's just Larry. And we can kind of talk to that voice and engage with it in a different way, because we now have a symbolic understanding of what it looks like. And so these are the ways that clients come in and we work with art. But what I'm actually doing in the room as an art therapist is I am often making art alongside clients. It feels a little clunky and like awkward if I'm just staring at my clients while they make art. I always want them to feel like comfortable in the room and that we're sharing in an experience together. So I'm often painting or I'm drawing. I'm using whatever medium that my client is using, and I'm working with them as well. And I am also observing and noticing a lot of things about the process. I'm looking at what materials did they choose to use. I'm watching their body language. I am even watching like the pressure of material use. Are you pressing hard? Are you pressing softly? I'm looking at the imagery and the symbols that come up. And these noticings just offer more room for exploration. So I might bring that up. I might say, you were pressing really hard on the page. Did you notice that? And my client might say, I didn't notice that. I wonder what that's about. And we can then explore the tension in their body. We can maybe explore what was coming up for them in the moment that they were making that art that was leading to all that tension. There's so much that we can do with this curiosity and noticing. And I'll also share that I am never interpreting what they've created. So if my client draws a star, I am never saying, you drew a star and that means this. I'm actually never saying you drew a star, because I want my clients to tell me what they have created. I want them to share their meaning and their process. So I might say, I saw you drew a pointed shape. Tell me about that shape. Or I saw that you used yellow. Tell me about yellow. And we create that meaning together. So there's not interpretation of images in that I am looking at something and I can see, your whole family history in the drawing. I don't see that. I ask, and I'm observant, and I am aware, and I want to be curious about your experiences. So being in an art therapy relationship is really relational, and it is about that trust and foundation in the relationship so that we can use art comfortably as a tool. So that is kind of all that I have about art therapy and how to be an art therapist. I also wanted to share, you know, if you want to pursue art therapy, because I know that you guys are in undergrad and you have some choices to make, and maybe art therapy might be what you want to pursue. This is how you can do it. There are a few programs in Canada. Most programs are 2 years post-grad and include a clinical internship or practicum. So there are prerequisites include undergraduate coursework in psychology and undergraduate or community studio art credits. So for example, I did my undergrad in psychology. And then in my undergrad, because I knew I wanted to go into art therapy, I was taking art classes at community centers so that I could get those prerequisites. You really need the art prerequisites, again, not because we're trying to make good art or instruct people how to make art, but we need to have just a basic knowledge and proficiency in art mediums so that you can effectively use them with clients, so that you understand how they work and how they flow. So you will need studio art credits for the majority of art therapy programs. There are master's programs. So Adler University is the program I attended. You get with Adler University a master's of counseling, psychology, and art therapy. So what that means is that when you finish your program, you are a registered clinical counselor. So that's like a talk therapist, and you are a professional art therapist. The reason that I kind of am like differentiating and bringing this up is because one of the main benefits of this training is that you can register as a counselor. Some insurance programs will cover art therapy for clients, but most will cover clinical counseling. So this is just kind of a practical way to ensure some stability post-grad. Concordia in Quebec also offers a Master's of Arts with art therapy, and you also get the Canadian Certified Counselor and Professional Art Therapist designations with those. And then the kind of most popular art therapy schools in Canada are the Art Therapy Institutes. So there's the Vancouver, the Kootenay, I don't know how to say that, but Kootenay, Toronto Art Therapy Institutes. You get an art therapy diploma. It's still a 2-year program, but it is not a master's degree. And at the end of this diploma, you become a professional art therapist. And so you can work the same way that I'm working as a professional art therapist. You just don't have that designation of clinical counselor. Some of the best art therapists that I know went to the Vancouver Art Therapy Institute or the Kootenay Art Therapy Institute. I think that program is really rad, but I do just want to share some of those practical elements of that post-grad life. And I'm sharing some resources. If you want to know more about art therapy, if you like books like me, the first section of resources is books. So you have Art as a Way of Knowing by Pat Allen. She's an art therapist. We have Art Heals by Sean McNiff. He's an art therapist. He sent me an email one time and it was so cool. He's like an art therapy pioneer. Big Magic is Elizabeth Gilbert. It's about creativity and how leading a curious and creative life can be really good for you. Maybe You Should Talk to Someone is a book just about therapy in general and what the therapeutic process looks like if you're curious about becoming a therapist. The Body Keeps the Score is just a really great book on trauma, and it goes into a lot of that brain stuff, and it goes into a lot of those alternative approaches to art therapy and why people might seek out alternative approaches. So those are some really cool resources. And then the resources just on the bottom there are all Instagram accounts, because I don't have TikTok, because I know I will be consumed by it. So they're all Instagram. Some of these people are on TikTok too. They all have websites, but you're going to have to click their link in bio for that. So there's some grads from Adler like me, and then there's some grads from those art therapy institutes too. So you can kind of get a sense of what other art therapists in Canada are doing, and you can kind of see too that like even though we're all in this field, we all work differently, and there's room for a lot of expression in this field. All right, you can connect with me too. I forgot that this slide is in here. That's just my email and my Instagram, and yeah, my website. So you're always welcome to reach out to me as well. I want to share too that I offer peer consultations. A lot of prospective art therapy students have reached out to me and just asked me about the field and the registration process and anything. So if you want to go deeper into this kind of stuff, tell me that you came to this presentation. I'll give you like a little discount for those consultations. It's cheaper than therapy, but I really wish that I had done a consultation before I did my master's degree, because I really didn't know what I was walking into. And I think it would have been like super helpful. So I love to be able to offer those to prospective students. And I also offer groups and workshops in my studio downtown. I really think that the best way to know if art therapy is the right fit for you is to experience it. So if, after this presentation, or maybe before this presentation, you were curious about going into this field, go to an art therapy workshop. It doesn't have to be with me. A lot of those people on the resources slides offer incredible workshops. A lot of them offer them online. See what it's like to be a participant. See what it's like to be in that space and to be exploring with art, and notice what comes up with you. You might hate it, but it's better to figure out you hate it before you're in a master's program. So that's kind of maybe my best advice, is just to explore a lot of options and let yourself have that curiosity around all of these things. Undergrad, we get so focused on the school and just getting through it that sometimes those options outside, we're not always aware of everything that we could have in our future careers. So have that exploration. And I just talked a long time, so let's do a closing. Maybe take a deep breath all together. Shake out your body. Maybe grab a drink of water if you need to. And that is it for me with my slides. And I think that we're moving on to questions now.
Yeah, so by all means, if you guys want to either just share, if you have any questions, just to kind of turn on your mics and share the questions, that's totally okay. If you want to type them in the chat instead, we will be monitoring the chat, so we would be happy to look over those as well. But yeah, any questions are totally welcome. I know I do have a few myself, so. I'm just gonna share our screen as well. Back onto our original. Oops. Awesome. So yeah, I guess one of our very first questions, also a question I had, was how did you first get into art therapy? And following up with that, what sort of like how did you mold your undergraduate degree to kind of get into this field?
Yeah. Okay, so I was in undergrad in the summer after my first year of undergrad. I worked at a community living, which, if you're not aware, it's just like a resource center for people with developmental disabilities. And there was an art therapist who came in and worked at that center. And I was like, what is this? Like, I don't get what this is. I actually wanted to do a studio art minor in university, and they wouldn't let me. So I had always just been really into art and interested in it. And when this art therapist came, I was like, oh, I didn't even know that existed. So then that was kind of back in my mind. And like I said, I learned more about art therapy from a presentation like this, a career fair at my undergrad. And the dean of Adler University actually met with me, and we kind of talked about what it would look like to come in for the master's program. So I was really fortunate to have an understanding of what it meant to enter into the field in my second year of undergrad. And then in undergrad, I didn't like change anything in terms of the courses that I was taking. The master's degrees really are like, have a developmental psych, have an abnormal psych, have stats, like all the things that you need to graduate anyway. So you don't really have to create a course curriculum that is centered on that. You can really study what feels interesting to you. But I did have to take those studio art credits outside of school. And I know with the Concordia program, which is a little sneaky, is that one of their prereqs is that you take an intro to art therapy course. And Concordia is like the only university that offers that. So they just want to feed into itself. So yeah, I contacted the university. I was in contact with them since my second year, and I knew exactly what I needed to apply. And so that is just like a really good way to ensure that you have everything you need, is just like talk to the admissions coordinators at the universities. They're available to talk to people about that kind of stuff.
Awesome. Thank you so much. All right, so we have a question from Dana in the chat. Is there also a research component to art therapy, Master of Arts at Adler?
So at Adler, it's a non-thesis program. So there is one course on research, which actually was pretty interesting, because we look at the research being done in the art therapy field, and there is a lot more now being done, where we look at how to do assessments, how to integrate research into practice, and that was more geared to if you wanted to go a really more clinical route, or do like a PsyD, you could do that at Adler, but it's not the core focus, especially because the Adler program is a master's of counseling psychology and art therapy. It's like you're doing a dual degree. So it is intense. I'm not going to lie about that, but I also know that any therapist that I know who did their master's degree or that like 2-year diploma, it's intense either way. If you're going to be a therapist, it's like an intense process. So the research wasn't a core component. I'm so glad it wasn't, because my brain is just not for that. But yeah, if you're looking for research, there is avenues to go down to explore that within art therapy.
Thank you so much. I just have a question in general about your experience at Adler University. I know just being in 4th year, I've been kind of like looking at all of my options, getting out there, and especially considering I'm looking for a non-thesis option. That has been one of my universities I've been looking at. But yeah, in general, how was your experience at Adler, and going through your master's degree, and all of in general?
Yeah. So I always want to be transparent about just like what post-grad education looks like. And Adler University is a private university, so it is expensive. It is a lot of money. It was the best option for me because I wanted the clinical counseling and I wanted art therapy, and I could get that in 2 years condensed. That being said, the experience, like I said, was intense because I was doing all this coursework. And when you're doing all the coursework and you are practicing therapy skills, it just creates this environment for a lot of stress. And so, self-care was really emphasized in our program, but it's much easier said than done. And I started going to therapy when I was in that program. I'm so glad that I did because I really needed a lot of resources and support. You are asked to be very vulnerable in your classes, to write assignments about your family history, to explore all of these things that you would explore with clients in the future, because you need to have a basic understanding of what it feels like to be in those situations, to be in that vulnerable place. So I don't know if it's unlike other graduate programs. I know that there are many people who have done their master's and been like, it was so intense. But the part that I was less prepared for is the emotional element, is the element of needing to give like my whole self to this program and needing to learn how to care and support myself while doing just like the academic component. I will say too that there's a new program director since I was there. So it's really hard to speak to what the program looks like now because I graduated in 2020. So a lot of things I'm sure have changed since the pandemic started, and there's a new program director. So my best kind of advice for if you're curious about art therapy at Adler is to like actually contact the program director directly and see what it's like, do a tour. But for Adler in general, I've heard really amazing things about the MCP program, Masters of Counseling Psychology program. It's been around for a really long time. It's the same sort of intense experience with all the emotions and everything swirling around. So that's always something to keep in mind if you want to go into a field where you're doing therapeutic work.
Awesome. Thank you so much. Right. There we go. So yeah, is there any significance to creating art, like sketching, with your non-dominant hand?
Okay. There's a process called bilateral drawing, which is getting like pretty popular in art therapy lately, where we use both hands at once. We're just looking at when we are doing that together. We're looking at being able to facilitate coping and engage in our nervous system in a way that is going to just like slow us down. I in general don't really use like, hey, use your non-dominant hand to sketch something or to draw something. I find that would offer a lot of frustration in the room, but I also use art for learning distress tolerance and frustration tolerance. So it could be a method for that, in that, so much of therapy is about widening your window of tolerance, is about understanding how we can cope with just our everyday stressors and give ourselves tools for dealing with stuff in a way that's going to be effective and helpful for us. And so something that we do is frustration tolerance, where we are replicating a frustrating event and then sitting with it, letting ourselves feel frustrated, not avoiding it, not engaging in coping strategies that might not be helpful. We're sitting with it, we're processing it. And so I work with perfectionists, and I'm like, we're gonna make bad art. Like, that is really frustrating, like, to not be in control. So something about like using non-dominant hand would be, I'm not in control of this as much as I maybe want to be. It would maybe lead to frustration, and then we work with that frustration. Or maybe it leads to flow. Maybe it leads to looseness. It kind of is all just like dependent on the person, dependent on our nervous system function, dependent on, you know, what we're doing that day, what our intentions are. So that's a really cool question.
Yeah, thank you so much. I love the idea of like the control and that totally just makes sense. So um, yeah, so really interested in managing multiple trainings and how to incorporate them into a therapeutic process.
Oh, okay, cool. This is like the chat question too, about blending eco therapy and art therapy into a session.
Yeah.
So I work from a holistic approach. I really can't speak to other people in the field. The majority of therapists that I know, though, work from a holistic or integrated approach. And an integrated, well, I guess integrated or eclectic, that's like therapy talk for, I use a lot of different approaches all at once. I don't really know a lot of therapists who are like, I'm only CBT or I'm only art therapy, because it can be limiting, right? And so we have this understanding of all of these different things and how they all align. And what my teachers would say in my program is that you have a therapy toolbox and you choose when to bring those tools out. And so we are continuously just attuning to our clients and their needs in terms of, you know, if a client comes in and they are in crisis and they just need to talk through what just happened to them, I'm not going to be like, maybe some like calming art. Like, I might at the end of session, but like sometimes they just need to talk and get everything out. And I want to be able to facilitate that process. And so stuff like blending multiple trainings, there's a lot of room for that. There's a lot of room for that complexity and nuance and planning too. So if a client comes in and I say, I think that it might be beneficial to look at this next time, like to engage in this process, to like I have a lot of somatic training. So to, hey, can we process this with our bodies and pay attention to that next time so that they have kind of awareness of what they're walking into. I might do that. But I might also just within the room be like, hey, can we shift to this place or this place? So to kind of answer to blending eco and art therapy is, I find that they are really blended already, because eco psychology is really recognizing kind of just like our inherent ways that we process the world and that we want to exist in the world. And art is conducive to that, because art, you know, like the first known recordings of human art was like 40,000 years ago. Like, art is in our DNA. It's like wanting to process with that. And so, you know, like something that I might do that's like an ecotherapy approach is I have like a whole wall of like nature stuff. Obviously, I like stuff like I have moss at my desk, and we might feel it. We might feel connected to the earth, connected to ourselves as just beings in our interconnectedness, in our common humanity, in the way that we share this earth. And then we might you know, introduce a drawing activity, or we might think of our place in this world and what that means. And maybe that's existential and it feels like we're really small, or maybe it feels really good and awe-inspiring. And we can then look at that through art. We can look at it through talking. We can look at it through body processes. There's not really like a formulaic approach to this kind of stuff. It's all just like what is coming up and what are ways that we can work with what is coming up. And sometimes those ways are a better fit. And sometimes clients are like, I don't want to do that today. And that's always okay to have our clients guide as well.
Wow. Awesome. Yeah, I do have another question, but just you mentioned earlier that the age ranges you kind of work with are like adults from like 20 to 40, and then also within like youth work. I just kind of wondering like how your experience between like working with like say like teenagers versus like adults, like how we kind of approach it differently.
Yeah, there's definitely a lot of different approaches. So with young kids, you're really doing a lot of focus on art. Like just come in, have a space where an adult is not telling you how you have to show up. So with my young kids, it looks like what kind of art do you want to make today? Or I might recommend something, or we do a lot of coping skills through art and build up those processes. With adults, it looks a lot like I said, with the blending of therapeutic modalities is like, what do you want to focus on today? How do you want the session guided? And I really like to offer my clients that invitation and be like, you're here for a reason. You're investing in yourself. And so let's like make the most out of your investment today. So with adults, it really looks fluid as well. And with teens are fun because we're gonna get into art and sometimes we are not going to talk at all. And that's okay. That's one of the first things that I always say to parents that I work with is that if your kid comes in and they don't talk to me, we're going to be okay with that. Like that just needs to be part of the process, is that they know that they can come in, they can sit down, they can do art, they cannot talk to me, and I'm not going to push them because I want to create that safety in the room. And so if all they are doing is coming in and doing art and getting an hour break from whatever's going on in their life and getting an hour off of screens and getting an hour of an adult sitting across from them and not expecting anything from them, that is enough. And so sometimes that's what sessions look like with teens. And then, sometimes teens are just like mini adults and we do a lot of the same things. Sometimes adults are just grown up kids and we do a lot of play, especially when we didn't have those coping strategies or that playtime when we were growing up. I like to introduce that in my adult sessions of like, hey, this is how me and my kids work through some of this emotional stuff. Do you want to try that? Like, you never got to do that as a kid. So do you want to play? And we get to have playtime. And that's really, really beautiful. So there's just so much fluidity in all of it. And like the common core element is just is allowing you to show up however you want to show up and validating those feelings. Any feelings that come up are okay. So like kids, we always do a feeling check-in at the start and whoever's in the room does it. So my client's siblings, the parent or caregiver, me, everyone in the room does a feeling check-in because I want those kids to know that they're not there because they're bad, that their feelings aren't bad, that they are allowed to have feelings and that everyone has feelings. And so whatever comes up in that room is okay.
Oh, thank you so much.
Mm-hmm.
Oh. All right. Yeah, I do have just another general question. Sorry, I have so many questions. It's such an amazing presentation. Throughout just like your undergrad, did you have any like experience like working around like with art therapy or just having like any volunteer experience or stuff like that, just out of like curiosity? Just kind of any hands-on experiences before getting into your master's?
Yes. I was a tryhard. in undergrad. This is part of why my focus in my therapeutic work is with high achievers and burnout and perfectionism, because I have lived that life. And so I was doing everything that I could to find a place in that field. So I volunteered for just doing arts and crafts with kids. In my job the year before I came to grad school, I was working with a community organization, and they worked with an art therapist to facilitate art therapy groups. And that's like the reason I took that job. It was like 2 hours a week that they had an art therapy group, but the art therapist said I got to sit in on them and like help her with them. So I was like, I'm taking that job. So yeah, I had a little bit of experience, but like therapy is such a interesting field because it's one-on-one a lot of the time, or like it's a closed group a lot of the time. So there's not a lot of opportunities, at least that I've seen, for volunteering unless you are in a clinical program, because the confidentiality and the safety of the clients are the most important thing. And I guess I can say too, I did volunteer at a hospital with an art therapist, and wouldn't recommend, honestly. Like, I was put in a group in an inpatient hospital. I was put in a room by myself, and I had no training, and I was just like, I like to paint. And I, like, looking back at that experience, I'm like, that was cool that they let me come and volunteer, but I didn't know anything about the materials I was using. I didn't know anything about how to interact with clients with complex needs. And so I think if you want to pursue volunteering, you've got to really like find an art therapist that is either open to that, or maybe just participate in a group. It can be enough to participate and have personal experience, or, seek out a one-on-one art therapy relationship, because that is going to give you a lot of insight into the process.
All right, we have one more question in the chat. So, are there any resources you could recommend to find some art therapy adjacent arts activities with groups of teens?
Okay. So not art therapy. Okay, this is what's really cool about art therapy, is that I'm a trained art therapist. I have a master's degree. I can say I'm doing art therapy, but like I said in my presentation, art is therapeutic in itself. Doing art processes can be therapeutic, and that means that art gets to be for everyone. So not everyone can say I'm doing art therapy, but anyone, all of you guys, can say, I'm working therapeutically with art on my own. I'm choosing to be in a sketchbook practice, or I'm choosing to paint when I feel a certain way, or I'm choosing to play with little plasticine because I want to have that sensory experience. So resources for groups of teens or groups of kids is look for what they're already interested in, and allow that to be your way into communication. So teens often like directive activities. So you might print off a bunch of mandalas, and you're going to color in mandalas together. Or teens, in my experience, also really love collage. So get a bunch of magazines and make a collage together. Teens are kind of at the age where art is more of a school subject, and is like, I'm good at art or I'm not good at art. And so engaging teens in art can be hard when there's that kind of dichotomy. So a lot of the resources for teens are more directive, are more like fill in the blank, or like use these magazine images that already exist. And so you don't have to draw a person. This person already exists, just cut them out. So those are some just really basic resources for how you can introduce art with teens. And I don't know, maybe just like bop around on those art therapist pages. We live in this like really cool digital age of sharing a lot of information, and a lot of those Instagram pages that I recommended, one that stands out is Art Therapy IRL. She posts all the time about like, hey, here's how you can do this art therapy activity for this. Bring those into your groups of teens. Don't call it art therapy, but just say like, hey, maybe we can try this together, because art belongs to everyone. We're all allowed to use art, however we want to use it. So find those things that like just fit for you in your group.
Thank you so much. Awesome. All right, so that is our time for today. I do want to give a big thank you to Elspeth for the presentation and the excellent answers to all of our questions. We really appreciate the time you've taken to speak about your experiences and look forward to collaborating with you again in the future. I would also like to thank all of our students for participating and asking questions and showing your support for the series. If you are a viewer watching the recording at a later date, we would love to see you at one of our live events soon. And thank you for making this event possible. So the Expert Talk series is a bi-weekly event, so stay tuned to our social media channels for more information about future events. And you can learn more about Elspeth on her website, intrinsic-therapy.com, or on her Instagram, intrinsic.therapy. Once again, thank you all for coming, and thank you, Elspeth. You have a great great evening, everyone. And it was lovely seeing you all and talking about art therapy. So thank you so much. All right. Yeah, I just want to reiterate what I said. Thank you so much, Elspeth, for
Okay, welcome.